Hello, my name is Annika Thoresson. I work at the Center for Innovation at Karolinska University Hospital in Stockholm, Sweden. I work as an innovation manager, and I'm here at ISPIM to learn about the latest research and trends and find tools that I can bring back to my workplace. My background, I'm a trained engineer in biotechnology, and I kind of entered the field of innovation management coming from project management. So I started to work with industry collaborations between academia and healthcare, and we built that on a traditional product management approach. But we quickly realized that when you move into fields with high uncertainty, traditional product management doesn't really serve you as well. So that's why we started to look at alternative methodology, and we more and more realized that the tools of innovation management was a good fit basically for what we try to achieve. My main learnings is that if you want to achieve innovation in healthcare, it's all about the people, meaning that you have to get the people with you on the journey. So it's very much about making people interested to try this methodology, and also to form these multidisciplinary teams. And there it's a really important role of being like the translator between different types of professions, different skills, to make sure that people see the same thing, more or less. So I would say that it's all about relationships. I think that the field of healthcare has a lot of challenges. I mean, we see the entire playing field being changed right now with the rise of chronic disease, an aging population, etc. So we just realized that we can't keep doing things the way we have in the past, because that just won't be enough going forward. So I think that the role of innovation is trying to introduce alternative ways of making sure that we can provide equal healthcare going forward. I think that a lot of things will change in 5 years. I think that the entire rise of this platform company forming, I mean, if you look at the big five, and I mean, we see entire industries being radically changed and disrupted, and I think that healthcare will be part of that journey. Exactly how it will look in 5 years, that's difficult to predict, but I think with AI, we see machine learning, we see all this new technology, and they also see a shift in power dynamics. I think that the role of the patient will be much different going forward. I think that healthcare will be steered more from a patient perspective going forward, and I think that's something very positive. I would advise them to don't be afraid to take risks. The only thing that we know about the future, that it's going to be different from where we are today. So try a lot of different things, and don't be afraid to go into the unknown. Embrace it instead. I think it's all about creating a common understanding of the challenges for the different organizations. It's very easy to point finger and say, why did they not just do this? That would make things easier for me to get a common understanding of what the roles of the different actors are, in order to collaborate the best way going forward.